don't give up, because you're important, and it really does get better.
When calling the Suicide and Crisis Lifeline since 2022, an option to press 3, which allows the caller to connect with people who are specifically trained to help LGBTQIA+ youth, is available.
I think it's something like 1.3 million people have used it since it was created a few years ago. That's heartbreaking, but it's profound. And it also shows the humanity of it and how it's needed.
But on July 17th, that option will be removed. The Department of Health and Human Services Substance Abuse and Mental Health Services said in a statement, this cut is to, quote, focus on serving all help seekers, including those previously served from the Press 3 option. And President of Rainbow Pride of West Virginia, Chris Gossis, says it's states like West Virginia that need these lifelines the most.
We already have so much isolation in many parts of the state, and it's going to hit us even harder than it will in more populous areas. So things like that, the 988 with specific LGBTQ trained individuals, those things are made for places like West Virginia, where there are folks, even well-intended folks, have no idea how to communicate with someone from our community. And having the lack of a trained person in such a critical area could end up doing more harm.
Gossis says he feels removing the specialized help for LGBTQIA+ people may make some hesitant to call for help.
Pulling that away kind of strips the humanity away from, and almost prevents people from calling 988 if they are in need. Because it sends a message that their concerns, that their life, that their stressors aren't as important or aren't as valid.
According to the Center for Disease Control and Prevention, in 2020, it was found that suicide is the leading cause of death among people aged 15 to 24, and LGBTQIA+ youth are at a significantly increased risk.
What I would say to somebody who may be in need is there are people, there's a whole community ready to embrace you, to support you, and there are resources. Sometimes you just have to raise your head a little bit, and we'll grab your hand and we'll help you get through it.